the merit bonus is a good step forward, as well as what we can do to support our retired teachers in their ever-escalating healthcare costs and premiums and deductibles and co-insurance. This bill is paid for through a deferral of the managed care organization payment, I believe in August of 2019. Can you explain the mechanism of that and what you envision regarding the MCO payments going forward to give some reinsurance to providers as well as to the managed care organizations?
Yeah, I'd be happy to, and the utilization of that source will pay not just for these two purposes, but also Senator Taylor's bill that he laid out. Was that yesterday? My hope, Senator, would be that we wouldn't need to use the deferral at all, but pay for this in the supplemental if we have revenue available. And I would love for our comptroller to tell us that the economy's picked up well enough for us not to have to use a deferral. However, if we're not able to do that, my intention would be to defer the payment for actually 2 weeks is what it would take. From the last payment of the fiscal year 18-19 biennium, which would be August of 2019, right? 2019, to the first month of the 2021 biennium, which would be September of 2019. So really there's a 2-week period there. And my intent absolutely is that there will be no impact to provider rates or benefits or services for Medicaid members, and we've talked about this. We have assurances from the commissioner that he will help us ensure that we're not having any kind of negative impact. It's also my intent that the deferral will not put our managed care organizations at financial risk. And so we'll be following it very closely to make sure, and I want to state for legislative intent purposes that absolutely is our intent that there will be no impact to provider rates. And I appreciate your concern there as well.
I appreciate your answers.